The process for someone who's interested in elective oocyte cryopreservation, or egg freezing, or personal egg banking as we call it, starts off with an initial consult with a physician. We then go over what the process is, we order some diagnostic testing to make sure that the process is likely to be successful for you in the future, and then the patient undergoes the treatment of IVF. What IVF involves is taking a series of hormonal injections, can be as little as 8 to 10 days. These medications cause multiple follicles, which are the homes of the eggs, to grow. When the follicles are ready, we then do a procedure called an egg retrieval. It's a procedure done in our office by a physician where she gets medicine through the vein, so she is asleep and pain-free, and attached to a vaginal ultrasound is an IV needle that passes through the vagina into the ovaries, and we collect her eggs. It's a quick procedure. It takes about 15 minutes to do. It's a safe procedure. The chance of a problem is less than 1%. She gets to leave within a half an hour, and then everything else we do in our lab. A candidate for egg freezing is any woman who wishes to maximize her reproductive potential in the future and is not in a position to achieve pregnancy at the moment. Or a patient who wishes to preserve eggs because she knows she will be undergoing surgery for endometriosis or to remove the ovaries or other GYN conditions that will not allow her to try to achieve pregnancy in the future. An additional benefit is that as a woman ages, there is an increased risk of birth defects. There's also an increased risk of miscarriage, and therefore we're able to capture again these eggs at a time when a woman is more likely to lead to a healthy pregnancy. Personal egg banking or elective oocyte cryopreservation is now considered a standard of care. It is not considered experimental. Over 1,000 babies have been born worldwide, and there's no increase in miscarriage or birth defects or any developmental or chromosomal problems. I think this is the one technology in the last 10 years that has completely revolutionized our field and has allowed us to bypass the one aspect of reproductive health that until now we have not been able to do anything about, and that is reproductive aging. And so I think it's a very exciting time to be in reproductive medicine.